Good afternoon and welcome. This is the first of 4 panel discussions that we are having as part of the launch of the University of California Center for Climate, Health, and Equity. The University Center for Climate, Health, and Equity brings together the leadership and resources of the 10 University of California campuses with a mission to advance climate action that prioritizes health and equity. Through our 4 core pillars of research, education, health system sustainability, and policy, we are working to generate and uplift climate solutions that support healthy communities and a healthier planet for future generations. I hope that many of you were with us this morning for our launch event, where we heard from our center directors and so many climate health leaders about the possibilities for action and the role of the university in creating change. And for those of you who are newly joining us, we invite you to visit our website to learn more about the center and also to view recordings of our other events. I also just wanted to remind everyone to please register for our events tomorrow. We have 3 more exciting panel discussions on climate and health education, on mental health and climate change, and also hearing from policymakers on how to bring health and equity into our climate policy. So turning to our session today, when we think about climate and health, we often think about the health impacts of extreme heat, hurricanes, and other discrete climate events. But our health isn't only harmed from these climate events. And in fact, the fossil fuel industry is a source of tremendous health harm. Recent studies show that air pollution caused by the burning of fossil fuels results in 8 million deaths each year, around 1 in 5 of every death. And the extraction, production, and transportation of fossil fuels results in air and water pollution that causes a wide range of adverse health outcomes, from cancer to poor maternal and child health. The fossil fuel industry also plays an outsized role in shaping the way that the public thinks about climate change. While industry has known for decades about the risk of oil and gas production and the burning of fossil fuels, they have long denied climate change and fought successfully against policies and regulations that would protect human and planetary health. At the same time, there is a growing movement of climate activism aimed at countering the role of industry, from community organizing to litigation to divestment campaigns. And that's what we'll be talking about today. Before we get started, I just wanted to note that the Q&A feature is open, so you're welcome to ask your questions to the panel. However, we may not be able to answer every question that is asked, so apologies in advance. And with that, I'm going to turn it over to our moderator today, Huang, who is the Vice Chancellor of the UCSF Office of Communications. Huang oversees UCSF's communication programs, serves on the Chancellor's executive team, and is also counsel to the UCSF Board of Directors. Huang previously served as Vice President of Strategic Communications at the Energy Foundation, where he established the first ever issues management program in climate change advocacy and a regional communications network spanning 20 states. He has served in executive communications roles at Kaiser Permanente, Wells Fargo, Gap, and Genentech, and previously worked as a news producer in radio journalism. So welcome to Huang, and take us away.
Thank you very much, Naomi, and welcome to everyone joining us for the panel discussion today. I'm going to offer a few framing remarks and then introduce our 4 panelists. We have a really good lineup of experts here, and I'm eager to get to their remarks. But first, let me just offer that, as the economics of the fossil fuel industry's business evolve, gas extraction, of course, has become one of the most critically important fronts for climate change. This has dramatically increased the stakes of global warming, it's amplified environmental consequences, and broadened the impact to health. It has also complicated the response of advocates. We know that for decades, the fossil fuel industry has denied the reality of climate change. It mobilized a well-funded, integrated campaign of policy, political, and cultural strategies that promoted misinformation and protected their economic interests. In recent years, there's been a shift. Advocates have exposed the industry's big lie, manufactured and reinforced over the years. Today, the industry seeks simultaneously to subtly deny the impact of climate change while also delaying action to avert it. We need look no further than the playbook of big tobacco to understand the evolutionary arc of the fossil fuel industry. First deny, then delay, and finally move to co-optation. Their policy, political, and cultural strategies today are as complex as ever. They continue to exercise deep policy influence through a network of conservative and industry-backed think tanks and regulators. Their political influence has secured a deep network of sympathetic legislators at the federal and state levels, and they continue to advance cultural strategies that play up misleading narratives of cost, reliability, and national security. Increasingly over the years, the fossil fuel industry has invested in these strategies to amplify the culture war between conservatives and liberals in this country and elsewhere. Distorted through the lens of partisanship, climate change action has been falsely framed as attacks on individual liberty. We need look no further than the results of our elections to understand how effective this comprehensive campaign has been in persuading millions of people to vote against their own interests over and over again. In today's panel, we have the honor of hearing from a researcher, an environmental justice advocate, an investigative journalist, and a lawyer about the many ways the fossil fuel industry impacts health. Our panelists today will speak about the fossil fuel industry and their tactics aimed at denying and delaying climate action, which has for years and continues to this day create disproportionate impact to the most vulnerable communities in our society. As leaders from different sectors of the advocacy community, they will share their strategies and how the health community can support and engage in these efforts. Julia Olson is the Executive Director and Chief Legal Counsel of our Children's Trust. After becoming a mother and realizing the greatest threat to her children and children everywhere was climate change, she focused her work on representing young people and elevating their voices on the issue that will most determine the quality of their lives and the well-being of all future generations. Julia founded our Children's Trust in 2010 to lead this strategic legal campaign on behalf of the world's youth against governments everywhere. Julia leads Juliana versus United States, the constitutional climate change case brought by 21 youth against the US government for violating the Fifth Amendment rights to life, liberty, property, and public trust resources. Kelly Mitchell is a senior analyst with Documented. She covers the oil and gas industry, conducting research and providing expert commentary on issues including bankruptcy, orphaned wells, state regulatory agencies, and ESG. Her work has been featured in Bloomberg, the Washington Post, CNN, the Wall Street Journal, and many, many more media outlets. Kelly was previously the climate campaign director for Greenpeace USA. Rachel Morello-Frosch is a professor in the Department of Environmental Science, Policy and Management at the School of Public Health at UC Berkeley. Her research examines social determinants of environmental health with a focus on structural inequality, racism, and psychosocial stressors, and she explores this environmental justice question in the context of exposures to environmental chemicals, ambient air pollution, drinking water contaminants, climate change, and effects on women's health, perinatal outcomes, and the development outcomes in children. Rachel has also collaborated with communities and scientists to develop science policy tools to improve regulatory decision-making and advance environmental justice. Finally, our last panelist, Vivian Huang, is co-director of the Asian Pacific Environmental Network, APEN, working alongside immigrant and refugee community members to build power and advance the organization's collective strategy for just transition and systemic change, catalyzing innovative models and deepening embodiment of feminisms and shared power. Prior to working at APEN, Vivian spent a decade working on policy, legislative, and budget campaigns. She's also been a facilitator, trainer, and teacher with the Women's Policy Institute, School of Unity and Liberation, and the San Francisco State University Department of Public Health. So welcome to all of our panelists. I'm going to start with a question that's going to go to Rachel. So Rachel, throughout the launch event, we've been talking about health impacts of climate change. And the fossil fuel industry itself also causes direct health harms through its extraction and developmental activities. You have done some research on perinatal and maternal health and the impacts of these activities on those areas. Can you say a little bit more about your work there?
Yeah, sure. Thank you. And thank you for having me on this panel. It's great to be with such an amazing group of people working on this issue. There's been a proliferation of great research on looking at the perinatal and maternal health impacts of oil and gas extraction. And a lot of it began in places where fracking really took off, like in the Marcellus Shale in Pennsylvania and places in Texas and Colorado. And surprisingly, little had been done to look at what's the health impact, and particularly the perinatal health impacts of oil and gas extraction activities in California, where the industry is well over 100 years old, because California for a long time was the #1 oil producer in the country. Now we're at around 8. It's been going down. So we saw this huge data gap and sought to fill it because there's been a lot of concern around particularly communities of color who are on the fence line of these oil and gas wells about the health implications. So our research has looked at the impacts of oil and gas production and has found that proximity within a kilometer of living near active oil and gas wells, particularly high production wells, leads to increased risks of having low birth weight babies, small for gestational age babies. A similar study done by my postdoc, Dr. David Gonzalez, found increased risk of preterm birth, particularly among women in the San Joaquin Valley. Other studies have also seen increases in respiratory disease and mental health outcomes like depression, and then also cardiovascular disease. And I think this is important in California because we're unique in that a lot of the oil and gas production is also in very densely populated urban areas in addition to rural areas. We're also seeing much stronger effects in adverse perinatal outcomes among rural women compared to urban women, although the effects are also widespread. We've also seen in terms of environmental justice implications that communities that have historically suffered from racist redlining policies in the 1930s, where the federal government homeowner loan corporation drew maps and redlined certain neighborhoods as risky for investments and bailouts for mortgage loans from the federal government in the wake of the Great Depression. That those decisions nearly 80 years ago have impacted the extent to which those communities are more likely to be living closer to higher numbers of wells and a higher density of oil and gas wells, and that's across the country, not just in California. So this is also a huge environmental justice issue. There's structural causes for the inequities and the impacts of the oil and gas industry in California and nationally.
Thanks a lot, Rachel. You know, Vivian, APEN has been doing work with frontline and fence line communities for many, many, many years. And so the issues that Rachel's talking about, of course, have direct relevance to the work that you lead at APEN. Can you tell us a little bit more about the sort of actual lived experience, if you will, of these frontline and fence line communities? I think for a lot of people watching, and maybe for many of us, that experience is a little too far removed from our daily activities.
Yeah, thank you so much, Juan, and thank you, Rachel. Yes, I mean, I think that, you know, at APEN, we've been organizing with Asian immigrant and refugee communities who are on the front lines of the fossil fuel industry and directly experiencing a lot of the really negative health consequences and health impacts from that pollution. And for today's presentation, I actually just really wanted to lift up some quotes and stories directly from our members ourselves. Some of these are actually come from a statement that I had put together for APEN many years ago. That was actually part of the True Cost of Chevron report that used to come out annually around the shareholder meeting. And so, but the stories just give kind of a better picture, I think, of like the lived experience that people are facing on the front lines. So the first quote comes from Christina Saturn, who actually at the time was a member of APEN and now has actually joined our staff. But she says, my name is Christina Saturn. I'm 22 years old and I live in Richmond, California. I was born and raised here in Richmond and I've never lived anywhere else. I've made many memories here throughout the years, but one memory in particular that I will never forget took place at my elementary school. We used to do routine drills in case of an oil spill from the local Chevron oil refinery. We were directed to line up single file with a piece of napkin over our nose and mouth as the teacher walked us over to a specific area. I was about 5 or 6 years old, so at the time didn't really know how these chemicals are so harmful to a young child's body. To think about it now, it's very scary. A piece of napkin was going to save my body from the toxics that was spreading through the air.
Thank you for that, Vivian.
Yeah. And then another quote just shares from Koi Sang, Say Chow. She said, I remember the refineries explosion in the 1990s. So this was actually before the most recent explosion back in 2012. But I experienced strong headaches and dizziness. Sometimes I still experience headaches and irritation in my eyes. It is hard for me to breathe and my body aches, right? And then we all know that in 2012, when there was the huge explosion at the refinery, the records documented that over 15,000 people went to seek medical care due to kind of the health impacts from what happened in the explosion. And then finally, I wanted to share that TORM has been an organizer with APEN from almost the very beginning of our organization, is a member of the Laotian refugee community in Richmond. And he often talks about just the sheer numbers of memorial services that he has to attend, that he has to plan, that he has to coordinate, and how so many of them are from cancer, right? And that we know that cancer is one of the health impacts, from the fossil fuel pollution. And just in January, I just wanted to share about we lost 2 longtime leaders in Richmond due to cancer. One was Ko, who was a longtime APEN member. She was on our leadership steering committee and who really just brought a lot of warmth and care to the work, but also was a very fierce, advocate for change. And then Mike Parker, who was a very respected and strategic activist with our ally Richmond Progressive Alliance, and both of them passed away from cancer, despite all their years of organizing in the face of what they were seeing and the impacts of their community members. So I think these stories just illustrate how there's really no denying, I think, the enormous and devastating health impacts that our communities face from oil and gas pollution.
Vivian, that's so important for us to hear more stories like that. The issues of climate change as it regards to policy and politics quickly becomes abstract. And to hear the first person accounts like that, I think we need much more of that. So thank you very much for that and for the work that APEN's doing with those communities. Kelly, let's turn to you for a second. You are an investigative writer, reporter, and you work for Documented. You've been doing a lot of work throughout your career to sort of pull the veil back on the fossil fuel industry's antics, essentially. And I think most people have a fair sense of what the industry's role has been in sort of misinformation and also policymaking. But maybe they're not aware just how deeply influential they are in some of their public policy and political activities. Recently, you've done some work actually that I found very interesting. You've been looking, of course, on how the fossil fuel industry has been exploiting the recent Russian invasion of Ukraine. So can you tell us a little bit about that work?
Yeah, absolutely. And I hope I don't have to be the one to tell this audience just how kind of cynical and opportunistic the industry is. So one of the things we saw, as the very early kind of rumors of war were approaching with Ukraine and with Russia, is we saw the sort of apparatus of the fossil fuel industry trade associations really mobilize in sync to push a very long-standing regulatory agenda. So we saw folks from the American Petroleum Institute, the Independent Petroleum Association of America, the Western Energy Alliance coming out and demanding from Congress, from the president, that the federal government essentially do everything in its power to facilitate a very speedy uptick in domestic oil and gas production. And, what's interesting about this push is it didn't just touch on some of the things you may expect, maybe some increased federal permitting, or streamlining, existing leasing or permitting that's on the books. These calls went much deeper, in some cases actually requesting that the federal government effectively dismantle NEPA, the National Environmental Policy Act, an act that's been in place since 1970, signed into law by Richard Nixon, and has been one of the bedrock tools that communities can use to actually challenge new oil and gas development in this country on environmental and health claims. So it was an incredibly aggressive push. And of course, what we saw on the other end, following the oil industry's communication with investors, with what they've been saying in industry conferences, is that despite everything happening in Ukraine, despite everything happening in gas prices, they actually have no desire to rapidly increase oil and gas production right now. They're quite happy with production at current levels because they're making more money than they have in some cases in the entire history of their various organizations. So it just reveals such a deep cynicism. And I think it shows their hand a bit, especially because the industry has been saying for years that we don't need additional regulations because the industry can self-regulate, that it is possible to do responsible oil and gas development that doesn't harm the environment, that doesn't harm human health. And as the first opportunity, they're basically revealing that, one of the things that potentially is holding them back from production is really basic health and environmental protections. And so it's a bit of a sad moment, but I think it reveals sort of the power of these industry trade associations to say the really hard, nasty things that even oil and gas companies themselves aren't willing to say, and the extent to which these companies, again, aren't just looking for reform on the margins, but are looking for really a complete dismantling of the apparatus that regulates their industry.
Thank you, Kelly. Julia, you have been one of the leaders in the emerging and very promising strategic field of strategic litigation. I wonder if you could comment generally, not specifically on the work that you're leading right now, but just for our audience, help them understand just the field of strategic litigation. There's been dozens of lawsuits that have been filed, not only against fossil fuel companies, but against the banks that finance their projects, as well as the governments that are failing to regulate them. So can you talk a little bit about the field itself, and what are you and your colleagues in strategic litigations trying to actually achieve with this?
Yeah, thank you, Juan. Thanks for the introduction. It's great to be here with all of you, Kelly, Rachel, Vivian, and having this interdisciplinary discussion. I think it's really important. So to give everyone sort of a picture of what the litigation landscape looks like. So I'd say, prior to 2 decades ago, the litigation around climate change in the fossil fuel industry was largely under what we would call environmental statutory law. So trying to fight one project at a time kind of approach. And then the next generation of cases, at least here in the United States, that took a different approach was what we call the damages cases. And those were cases brought against the carbon majors, the big polluting industries, to try to sue them for the public nuisances that they were causing or the negligence that they were perpetuating. And those cases initially failed at the federal level and up at the US Supreme Court. And so there was a regrouping. And over the last decade or so, we've seen new cases being filed by states and cities and counties against companies like Exxon, right? To try to recoup money from them for the damages that they have caused. And a lot of those cases are really about sort of adapting to the changing climate and getting money to build seawalls. The other category of cases that we're seeing emerge right now are these cases against banks, insurance companies, those that are backing the industry. And those, I think, are sort of the newer iteration of these types of creative cases that are being litigated to try to cut them off at the knees, right? If they can't get insurance, if they can't get funding, we can stop them in their tracks. The kind of cases that I'm involved in are really the rights-based cases. And back in 2010, our Children's Trust sort of initiated this turn to think about climate crisis in terms of rights, human rights, and particularly the rights of our children. And so those cases here in the US and across the world are really aimed at governments and the government's role in permitting and allowing all of the activities that the fossil fuel industry is engaged in as partners in this process that's really degrading our communities and our health. And I'll talk more about that in a bit.
Thank you very much, Julia. I want to return to Vivian and the work that you're leading, Vivian, with frontline communities. Tell us a little bit about how those communities are actually pushing back on the fossil fuel industry, and specifically, how are they leveraging health as a frame, as an area of work in sort of countering the opposition? Now, I'm going to amend my question just a little bit here, because there was a question that was put into the Q&A asking, is it productive for health leaders and health practitioners to sort of enter the frame and portray the fossil fuel industry as villains or the opposition? So tell us a little bit about your views on that.
Yeah. So, before I became co-director at APEN, I actually started out at the organization as our campaign organizing director. So doing a lot of our local organizing and campaign work. And so the example I want to lift up actually was some work that was involved in Richmond around the last time the Chevron refinery proposed to kind of expand their refinery operations and their refinery infrastructure. And just to share for folks who are not familiar, Chevron is, one of the largest polluters in the state of California, and it has a refinery in Richmond. It's very much embedded, I think, in a lot of the kind of city fabric, right? So Richmond High's mascot is the Oilers, which is a direct reference to Chevron. Chevron funds a lot of the STEM programs. They give funding to many of the nonprofits in the community, and for a long period of time, for most of the city's history, they actually were also involved in regularly backing different city council candidates, and really trying to maintain a group of decision makers, right, that would be favorable to their interests. So I just want to give that context, because I think those are the conditions, right, that I think our communities were organizing in back then. And obviously a lot has changed then. But one of the huge campaigns was around fighting this refinery expansion, and health played a huge role in our communications and organizing strategy. As I laid out, for many of our members, their connection to this issue is deeply personal, and it's deeply centered around health and well-being. One of the quotes that I found in an old press release was just our member, May, actually saying, lives cannot be bought with money. As much money as you can carry, even a full truck of money cannot buy your life. Right. And so from her perspective, it was very much framed in this way of thinking about health as being very center and vital to the organizing work. And so, so I think that throughout the different actions that we did, the postcards we collected, the mailers that we sent to community members, we consistently, brought health into the frame and into the messaging. And I think that is incredibly important and very helpful, I think, to have health professionals be messengers, in this struggle. We really tried to build kind of a broad coalition to have spokespeople that were really representing, many different aspects of the way that this issue really impacts people's lives. I think that, depending, I think in terms of specifically the question around should we always be portraying, Chevron as kind of the villain? I think that it depends sometimes depending on the communication strategy and kind of the conditions of the campaign. So I don't think there's kind of a universal kind of answer to that question, but I do think that there's definitely been moments where we've definitely utilized that frame, and there's other times that we haven't because of different conditions. I just want to lift up that I think currently right now we're in a statewide campaign around a scoping plan process that's happening through the California Air Resources Board. That also is, where a lot of environmental justice communities are really advocating for talking about a just transition, for oil and fossil fuel industries by 2045. And I think that that's a conversation that, is lifting kind of a lot of the local experiences that community members like ours in Richmond, but as well as many communities around the state are experiencing, and really trying to have statewide officials take action, right, to really address the health impacts and the impacts that we know on climate that are coming from fossil fuels.
Thank you, Vivian. Kelly, you've been doing a lot of work on uncovering the fossil fuel industry's activities in gas production, gas extraction and development. Tell us a little bit more about that. And maybe one of the sub-questions for you to consider is, how does the fossil fuel industry actually address the health harms associated with gas extraction, which are pretty well known? I mean, it's covered by mainstream media. So how does the fossil fuel industry counter that?
Yeah, it's a great question. Yeah, one of the things that I think has been an interesting evolution is that for some time, the industry actually really tried to build natural gas as like the healthy alternative. So you saw in, the kind of first 10 so years of the 2000s that gas, the build out of new gas fire generation, gas in, buildings, gas in vehicle fleets was sort of billed as this great way to reduce particulate pollution from coal. Obviously, that's a lot more of a challenge for them now because they're not competing head to head with coal. They're competing head to head with renewables and electric vehicles, and there's no winning that claim on health grounds. So what we have seen is the industry actually utilize a lot of the same techniques they've put into place with climate change around health claims. So some researchers that I work with recently found this kind of great / depressing presentation where FTI Consulting, which is a major consulting firm, and the Independent Petroleum Association of America were kind of recapping their many years-long efforts to sow doubt about the science and health claims around natural gas production. So looking at, the film Gasland, when folks were able to light their water on fire because of methane concerns, a growing body of evidence about groundwater contamination and radioactivity around oil and gas production. And they have waged a very well-resourced campaign with their own, for-hire scientists and experts to cast doubt on those studies and cast doubt on the groups that funded those studies. And I expect we'll see a lot more of that. A lot of really good data is coming out about the health impacts of gas in homes around gas stoves and how that's contributing to asthma and other respiratory illnesses, especially in low-income housing where people don't have good ventilation. So far, the industry's response is basically to try to debunk that, but I wouldn't be surprised if we see them start to produce their own studies that put forward that counter argument. So I think, I think they realize that going head to head on health claims is a losing argument. So again, sowing doubt and then using vagaries in that doubt to, using that doubt to then push, policies at the state and the federal level that limit our ability to rein in oil and gas production.
As you describe that, it always reminds me that they always seem to be just a half step ahead of some advocacy efforts. And if they're taking the fight into the domestic realm like that, it just seems to me that we need to have a good counter response already ready. Thank you for that. So, Juliet, you obviously have leveraged health quite effectively in your litigation strategies. Tell us a little bit more about how that works. How effective has it been? What do you see as the greater opportunity there?
So health from the harms of climate crisis and fossil fuel development is the most important part of our cases. In our work that we do, which is rights-based, constitutional rights-based, we're working on behalf of young people. And these youth are harmed in innumerable ways, but harm to their health, both physical and mental health, is, I'd say, the number one issue that we are dealing with in these cases. And so we rely on pediatricians, public health experts, immunologists, all the people who are really putting out this amazing body of research and publishing on these issues, and then coming in and acting as experts in our cases to really link the increase in heat or smoke or pollen counts or the incidence of infectious disease or what flooding does to young people. All of that is really critical. And another important piece is in our cases, we're also talking about the discrimination against young people, and young people from communities of color are even more discriminated against. And having the medical community come in and explain to judges why children are not just small adults but are actually physiologically different, which is something, you know, the EPA has long known, right? Children are different and they're affected differently. And the consequences of those physical and mental health harms today have really long-term consequences for their opportunities throughout their lives, and their longevity on the planet. And so I think that's just the most important body of work for us in our litigation. And I'm so grateful for people, you know, the work you're doing, Rachel, and others to get it out there in the world. And I think we could use more of it. And I have ideas about what that could look like going forward.
Thank you very much, Julie. I'm going to stay with you 1 second. The next set of questions really have to do with getting the panelists' perspectives on how much more effectively can we actually leverage health in the work that advocates are doing. I mean, we're scratching the surface in some of your comments right now. There's been a lot of good effort underway. There certainly seems to be greater opportunity ahead of us. So Julia, let's stay with you for a second. And let me ask you, in leveraging health as a key part of the legal argument, how exactly is health data and frame? Give us more examples of how the health frame and health data are being leveraged by your team, by other litigation efforts, and what would you like to see more of?
Yeah. So, for example, with all the fires that have been happening out west, there's been some new science really linking the smoke plumes to incidents of respiratory illness and impacts on children. Having more of that, like those very localized research studies done on specific events and how they're affecting, for me, children, but also other people. And another example is in the mental health field. Recently, there have started to be global surveys, and I think there's going to be a national survey of climate anxiety among young people. Having those kinds of studies done where researchers and scientists can then publish on those are really helpful in the courtroom. And for experts to be able to point to published literature that make these kinds of connections and findings. I think right now that there's some really good published science in this realm of climate change impacts or fossil fuel impacts on the ground in communities, but we need more of it as things progress and the situation gets worse. And often what I hear from pediatricians we talk to is they know among their client population or their patient population that there is significant harm happening, right? But it's not necessarily documented in a scientific publication. So getting more of that out there will be really helpful. And then on the flip side, you all, who are working in communities and working with patients, you see the people who might need or deserve representation. And so having another pathway for us to identify young people who have been harmed who might want to take their claims to court and are up for doing that. Like right now, we're looking for young people in California, for example, to connect with and talk to about a potential case. And so if there are people we can connect to in the communities where you work and the patients you see, connecting with lawyers is something we need to be doing right now as we're in this crisis situation.
That's really helpful context. Rachel, similar question for you. What is the role of health leaders in the work that at least you're touching? And when I say health leaders, I'm talking about researchers, scientists, and also talking about clinicians.
Yeah, I think, the body of science is incredibly strong right now about the health impacts of climate change. And I feel like it's also very robust in terms of the health impacts of the different segments of the fossil fuel industry on community environmental health, and it's also a driver of health inequities. And so, and again, we want to keep producing that amazing literature that can then be leveraged in different ways. But I think also as scientists, we need to do more stepping up in our role in translating that work and partnering with impacted communities to ensure that the scientific work that we produce can actually make a difference in improving public health and advancing efforts to better regulate and protect communities from the fossil fuel industry and advancing climate justice. And similarly, I think the clinical community, everybody loves their doctors, just like everybody loves firefighters, right? And so the clinical community can really, through their professional societies, can really, I think, play a very significant role in unifying their voice, lifting up this issue through their professional organizations and in the policy arena, and perhaps even thinking about creatively how to collaborate with impacted communities on accessible dissemination strategies. That could include producing reports alongside the peer-reviewed publications that can go in front of decision makers, synthesizing the science in a way that makes it clear what the regulatory paths are forward, and then also doing more communication engaging with the media, writing op-eds, and really trying to shift the conversation, because we have a role of privilege, both as clinicians and scientists, in speaking out on this. And I think in addition to producing good data, I think we all know that good data alone doesn't necessarily move policy. We have to really engage in that hard work of research translation and put faces, as Vivian did, on the data that we produce to connect the research with real life stories about how communities are impacted by this.
Vivian, let's take the same question that I posed to Rachel, and let's try to answer that from your perspective and your work with frontline communities. How can health leaders, again, broad category from researchers to clinicians and thought leaders, how can they partner more effectively with frontline communities? Rachel gave us a hint there.
Yeah, I was going to actually really build off a lot of what Rachel just said. I really just want to echo the power and privilege that I think health professionals really hold in our society, and how important it is, I think, to be really utilizing that and holding that well. One partner that I wanted to specifically lift up was just a lot of the work that we've done with California Nurses Association around the organizing and the work in Richmond. I've really appreciated, because they recognize that power and privilege they hold, but yet they've always supported the leadership of our community members and always followed the decision-making and lead of our members. And other ways that they've been good partners is just they understand the value of organizing. Right. And that it's not that they actually need to turn out people. They need to turn out nurses at different events, actually have health professionals up in actions and on stages and speaking and telling their stories too, from their perspective as a health professional, what they're seeing amongst their patients. And so I think that, one example I was thinking about is just, in the aftermath of the explosion that happened, I just remember we had this one event, where a nurse went up and talked about, the people that were coming in, in the aftermath of the explosion, and like what she was seeing as a professional in terms of the impact that it had on people's health. And then I think the other thing I want to lift up is that, we've been able to partner with not only CNA, but also other unions, like SEIU, for example, that represents a lot of service workers and other workers that are kind of allied and affiliated with health professionals, to really also support in the electoral arena. Right. So to think about how to really be organizing as part of, the C4 kind of the candidate work that needs to happen as well, in making sure that we get progressive legislators right into political office. So what I shared about kind of the conditions in Richmond has really transformed a lot in the last 10 years because of the work that has happened electorally to get a progressive block of city council members into office that has really helped to advance a more progressive agenda for the city. And then finally, I'll lift up too on our statewide work, that, Physicians for Social Responsibility, PSR, especially the LA chapter, has been really, really engaged in a lot of the statewide work. They're a partner organization in our California Environmental Justice Alliance, and just another example, of an organization that is organizing health professionals and really engaging in some of the key kind of policy decisions and policy fights that our communities are facing.
That's great. Thank you, Vivian. Kelly, I want to return to the last comment you made, where you were sort of anticipating about where the fossil fuel industry could actually go. Try to share more about your thinking there. And again, it's okay to speculate, I suppose. But I also want you to sort of consider and try to answer why the fossil fuel industry seems to be privileging other narratives right now. Either gas is cheaper than solar and wind. Solar and wind are not reliable because the sun doesn't shine all the time and the wind doesn't blow all the time. And then more recently, we've seen a resurgence in the national security argument about the necessity of fossil fuels as part of our country's energy mix. So help us understand, are they afraid of the health narrative, health frame, health leaders, or are they consciously avoiding it because they don't see it as a threat? And when I say that, I say threat yet, because I think there's potential there.
I think there's an extent to which they are avoiding it. And I think, you know, the examples that Vivian and others have shared, I think bring that to light in that, you know, I think in any community that's home to a major polluter, whether that's a refinery, an oil and gas field, like you will see very real, very tangible people with faces and names being impacted, you know, by these decisions. And very good science and research, you know, coming out about how this stuff is impacting communities. And so, you know, that's a hard thing for them to come up against. And so what we see again are these like really, I mean, to their credit, sort of creative approaches to try to manufacture some consent for their industry. And, you know, I'll talk just a little bit about sort of this gas stoves as one example, because it's kind of a new issue, especially on the health claim. But, you know, we have seen, you know, through the American Gas Association and their partner groups, we've seen everything from the gas industry paying Instagram and TikTok influencers to talk about how much they love their gas stoves. We have seen them show up to public hearings where new natural gas infrastructure is being considered and pay people in gift cards, basically, to speak out on these issues. We have seen them coordinate an effort across multiple states to pass these things called preemption bans, which would be state level policies that would ban municipal governments from instituting no new gas hookup policies or, you know, other policies that would prevent oil and gas infrastructure in their state. So, you know, there's sort of a funny example. I don't work a lot in California. I work in Texas, but there was a new, you know, Women for Natural Gas campaign that was launched there that was sort of talking about the health impact, how great sort of gas was for moms and for health. And then we discovered that their entire website was made up of stock photos. And like, you know, so they have to kind of go to these extremes to find, you know, people who will speak to the merits of natural gas, you know, as it's being debated at the community level, at the city level, and even at the state level. And so I do think that creates a huge opening, you know, like Vivian said, like Rachel said, of getting, you know, healthcare professionals and others into that space, because that's in a lot of places where this fight is being waged. And to, you know, think about, you know, other creative forms of communication and engagement. I don't think the University of California should be paying off Instagram influencers, but you know, there are other ways probably to be getting that message out with health professionals in more creative and ways to kind of combat just the sheer amount of disinformation that's out there at the moment.
Very illuminating. Thank you, Kelly. For final question, panelists, I'm going to ask you to put on your futurist hat. I want you to sort of project forward and try to anticipate where things are headed with the fossil fuel industry. For instance, we know, of course, that the industry is expanding its plastics production, and that's causing all kinds of additional downstream toxic harms to our communities. So in light of that, and maybe just sort of, again, casting forward a little bit, what do you anticipate are the next big priorities that the health community certainly, but the advocacy community in general needs to stay focused on? We have a lot of researchers and a lot of faculty watching this program, I assume. Help guide them in terms of where should they be putting their attention as we anticipate what comes next. And I'm gonna just ask Rachel to start.
I get to start with the hard question. Great. Yeah, I think, again, one of the big things I think is important, both as researchers, but also as advocates and organizers is, and I think Racial justice and EJ organizing has really helped us do this. I know for me as a scientist, it's helped me think more holistically and really make important links that I might not have otherwise thought about before. So an example is, links. What are the linkages between police violence and communities of color in the fossil fuel production industry, and the extent to which the fossil fuel industry employs municipal police, private security firms to come down very hard on protests in indigenous lands and tribal lands against the KXL pipeline. How do we make those connections between indigenous rights, indigenous sovereignty, and the climate crisis? Another example is you have climate activists that are literally protesting prison conditions for asylum seekers coming to the United States in private prisons along our border. And the fact making those connections between the proliferation of climate forced migration to the United States, and it is also combined with political tension, but those things have been made worse by the inability of rural communities to make a living, in part because of climate change. So making those connections so that we can talk to a broader array of constituencies and make those linkages between those movements, and then have more power to influence the policy conversation. And I think the second thing is, again, I think Kelly raised this really well, is that the fossil fuel industry propaganda machine is very nimble. So whether it's about our use of gas in our houses and the fact that it's healthy for us, to now all of this marketing around plastics recycling, and the fact that plastics is really plan B for the fossil fuel industry, because they're seeing the writing on the wall around the move towards renewables. And so both as scientists, clinicians, as organizers, really trying to figure out how we strategically think about our research and then how to leverage it for policy change. We want to be making those connections and anticipating those kinds of things.
That's great, Rachel. Thank you. That was very helpful. Julia, on the litigation scene, what are you anticipating? What's next?
Yeah, I mean, I guess what I would encourage everyone to also be attuned to is the legal landscape and what's happening in the courts, because I mean, literally every single thing the fossil fuel industry does is under permit by a government agency. They cannot do what they do today without government approvals and permits. And one of their tactics is to dismantle the regulatory state, dismantle all of these rules that apply to them. I've had a conversation with folks at the Federal Society recently. They want to go after laws like NEPA. They want to go after laws that help disclose the environmental consequences of industry projects. And, you know, we've all seen what's happening in the Supreme Court. So really paying attention to their attacks in the courts, what they're going to be doing. Next steps, we'll be paying attention to that. And I think it's why this rights-based approach is so important, because we can't just rely on administrative law. We need to really root the rights of people to their health and their security in their homes and in their communities to fundamental rights under our constitutions, whether they're state constitutions or our US Constitution. So that's the work at our Children's Trust that we'll be continuing to build as a counterpoint to everything the industry is trying to do.
Thank you, Julia. Kelly, let's get your perspective a little bit in terms of plastics. Let's talk about plastics a little bit more. Where do you see the sort of end game of that? Are they actually making progress right now in expanding the plastics market as Rachel described, its plan B?
Yeah, it's a great question. Yes, I would say up until this very sort of recent period where we now see, you know, gas prices, oil prices spiking, and, you know, companies in this very near term setting making huge amount of money on traditional oil and gas demand. Yeah, plastics has long been a plan B for the industry. And, you know, I think in addition to, you know, their propaganda around recycling, which I think has been, you know, very effective. The oil and gas industry, the plastics industry has known for years that, you know, the vast majority of things that we all believe are recycling are actually just ending up in landfills because it's so unbelievably cheap to produce new plastic material in this country. So that, you know, that propaganda has been, you know, out there for a long time. I also think folks don't always sort of make the connection between the fact that almost all plastics are just a byproduct of fracking. So when fracking takes place, there's a whole bunch of materials called natural gas liquids that are produced in the process. For a long time, this has been a problem for industry. This has been a waste stream that they need to do something with. And they found a great thing to do with it, which is to pipe it to huge petrochem facilities, largely in Louisiana and in the Ohio River Valley, and turn it into the building blocks of plastics, which they can either produce domestically or ship overseas to be turned into plastic and shipped back to us. So it's a huge growth area for the industry. It's a place where, you know, the number of new petrochemical facilities being, you know, produced right now or being permitted right now are vast. There's over 100 right now that are in some form of production. And in all those communities, as you can probably imagine, the health impacts are very severe. I'm not a health professional, so I won't speak to any of them in particular, but it's a huge risk. It's a huge risk to local communities. And yeah, definitely a major growth area for the oil and gas industry moving forward. It's also just a bit of ongoing propaganda, I'll just add on their part, right? Like, I think as we move forward in tackling climate change and move forward in tackling, you know, some of these health issues, we increasingly are seeing very, very slick advertising campaigns reminding folks that everything you own, everything you touch is in some way connected to oil and in some way connected to petrochemicals. And that's why even if you know, care about human health and care about climate change, we're sort of stuck in this cycle of constant dependence on industry. And I think psychologically, it's a really powerful message for the industry to be sending and can help build, you know, a sense of despair. So it's an important thing for us to push back on, because we can absolutely break that cycle of new petrochem facilities and new plastic production.
Thank you, Kelly. Vivian, I think that probably what you've heard from our fellow panelists here is resonant for you, because you probably deal with, probably in one way or another, a little bit of each of their worlds, right? So tell us from your work and working with frontline communities and fence line communities, what you're anticipating. Where's the next frontier of this fight going?
Yeah, I was going to add on, I think that, you know, just the next frontier is really a lot of the quote unquote false solutions, false quote unquote solutions that I think the industry is going to be putting out there. So, you know, I think what Kelly was highlighting around kind of the entrenchment, you know, in plastics as a way to continue supporting the industry. I think similarly, you know, we're also hearing about, you know, this carbon capture and storage technology that the industry is also pushing, that also just would basically create a lot of systems that don't actually reduce our dependence on the extraction and consumption of fossil fuels, you know, but really just tries to extend kind of the life of that infrastructure. And so those are just examples, I think, that of different ways that I think the industry is going to try to put forward what they're going to champion as solutions that don't address the root causes, you know, of the harms that our communities are facing. The other piece I wanted to name that is kind of on a more hopeful note is that, you know, I think that I think there is a certain extent of that, you know, the just transition is really possible, right? In terms of what we're seeing around like the conditions, you know, of our world, and the conditions, I think, of where a lot of the shifts have happened around decision makers and elected officials. And to note that, you know, in any sort of just transition, though, we want to make sure that it's done on our terms, right? That it's not just a Chevron refinery deciding, you know what, this is no longer profitable and we're just going to leave, you know, we're just going to close up overnight and leave. And all of a sudden, you know, the whole community is out of a job, out of, you know, any sort of kind of any opportunity to actually get like reparations or like kind of restorative measures, you know, around the harm that's been created. And so, so I do think there is a whole body of work that is happening, you know, around conversations around like what does a just transition for workers and community look like, right? And how can it be done in a way that is very fair and just and supportive of what communities needs, and also really repairs the harm that's been done to workers and communities for too long.
Thank you very much, Vivian. You know, I'm going to turn it over to Naomi in just a minute, but let me just wrap up here with a couple of statements. First of all, thank you to all of the panelists. I was so excited that we had such an incredible diversity of experts from different aspects of the advocacy movement. Quite honestly, you make me miss the fight. You really do. And it's just really exciting. And I have such a deep respect and admiration for the work that each of you are leading with your respective stakeholder groups. So thank you very much for that. And also thank you for your observations and insights today. I'm hoping that our diverse audience, which I know has a bunch of academics in it, but a bunch of advocates also listening as well, I hope that they've drawn as much as I have from the comments that you've shared. I'm going to state something very obvious. Health doesn't discriminate, right? The health impacts of climate change care little about anyone's voter registration. This is harkening back to the comment I made about how this has been leveraged against the population from a culture war perspective. So I'll raise just a couple of rhetorical questions for us to sort of consider and to move on, and which is, could advocacy work in health do more than what it is doing now to accelerate climate action? Could leveraging health help neutralize perhaps the culture war in which our issue is unfortunately embedded? Certainly, the advocacy community's strategies need to be as diverse as our opponents. We need to meet them in every venue we find them, whether it's policy, political, or cultural. And I think that what we've heard today is a good representation of just that work happening right now. So with that, I'm going to just thank you again, Kelly Mitchell, Vivian Huang, Rachel Morello-Frosch, and Julia Olson. Thank you for your time. Thank you for your work. Thank you for your insights. And with that, Naomi, I'm going to turn it back over to you.
Perfect. And thank you, Juan, for moderating this amazing discussion. We're over time, so I'm just going to echo the thanks and remind everyone to please register for our events tomorrow. We have 3 more wonderful discussions coming up. And thank you to everyone. Have a good afternoon.